Hello, my name is Aarya Ramprasad, and I will be presenting on behalf of my team for our poster, Interdisciplinary Reconciliation of Recommended Lead Vest Usage Among Medical Specialties. Radiation is a danger that is known to all, but it does often become overshadowed by the high-paced lifestyle of many physicians. Some of these effects of radiation are dose-dependent and include erythema, dermal atrophy, fibrosis, necrosis, reduced blood cell production, and infertility. Two professions where radiation exposure is very common includes radiology and orthopedic surgery. The practicing radiologist in the U.S. receives an annual average X-ray dose of 3.2 MSV, while orthopedic surgeons have varying amounts of exposure, with those on trauma having the most monthly radiation of 79 mrem per month. A frequently used method to combat radiation exposure includes lead vests with an apron of even 0.5 mm thickness being able to attenuate approximately 90% or more of scatter radiation. These vests are not required during all surgical or radiological procedures, which can put the physician at risk. Most are recommended but are optional for use. So we aimed to investigate whether radiologists or orthopedic surgeons more compliantly used lead vests when exposed to radiation. For our methodology, we had 300 physicians being sent out surveys with a breakdown of 150 orthopedic surgeons and 150 radiologists. Our survey comprised of two questions. The first question was a yes or no question as to if the physician wore the lead vest at all. The second question asked that if the physician participating was to have 10 procedures or events where radiation exposure was involved, how many of those times would they opt to wear the lead vest? So for our results, out of the 300 physicians that were sent surveys, we had 258 respondents, which was 86%, with a breakdown of 109 orthopedic surgeons and 149 radiologists. For our first yes or no question, 253 out of our 258 physicians who replied stated that they did use the lead vest. This comprised of 107 orthopedic surgeons and 148 radiologists. For our second question, for the average number of times for lead vest usage in the event of a radiation exposure, the average amongst radiologists was 8.4 out of 10 times, while for orthopedic surgeons it was 6.1 out of 10 times. And so our results showed that radiologists were more likely to wear the lead vest compared to orthopedic surgeons. Though almost 98% of both radiologists and orthopedic surgeons stated that they do wear the vest, the variation in frequency per radiation exposure varied greatly, with a difference of 2.3 times per 10 encounters between the two groups. Some reasons for this discrepancy may include that there is more education surrounding radiation exposure for radiologists, with the continued reinforcement based on their professional environment. Other reasons can include that the weight of the vest can lead to excess musculoskeletal strain in lengthy procedures. So for radiologists, the length of procedures varies greatly compared to orthopedic surgeons, which could lead to the surgeons being less inclined to constantly wear the vest during surgical procedures. All surgeons are currently recommended, but are not required to wear vests during surgery. There are many government-regulated programs that are run by the FDA as well as other hospital-associated institutions that can help reduce radiation exposure, but very few hospital institutions mandate the usage for each profession and for every single exposure. Only certain surgeries, such as interventional procedures for radiologists and spinal surgeries for orthopedic surgeons, are documented to have quite strict rules on wearing the lead vest. We hope that by shedding light on this topic and providing these numbers, that we can reinforce the dangers of radiation exposure to physicians who commonly encounter it, and that these future physicians can help enforce lead vest usage more strictly for their own safety and for others, as well as promote the information and research on more ways to prevent radiation exposure for those who encounter it frequently. Thank you so much for your attention, and I really appreciate it. If you have any questions, I would be more than happy to answer them.